Yeah, I love the fact that the word humanity is used in the question, because then I also take it personally as what should we do to help? But no, I think it's a great question, and from our perspective, I think COVID has really had a massive impact in a positive sense as well, to raise health consciousness, to make people aware of the sensitivity that we all have to risk of disease, in this case, infectious disease, and how age is not just a number. It's something that's biologically accelerating or slowing down for different people depending on how they're living their lives. And so I think this is a bit of a wake up call, both for humanity, but also for the healthcare systems, to recognize that there is a lot more that we should be doing to prevent, let alone care for people when they get sick.
Coming from the brain health perspective, in my field, most people do not care about their brain health until something happens. A family member, loved one has a neurological disorder or a psychiatric disorder. And we've seen with COVID this increase in, mental health issues. Nature just published a study that showed, the CDC reported this December, that there was the increase in anxiety and depression. It was at the level of 42%, whereas previous December it was at 11%. So people are now caring about their mental health and their brain health, and they're being empowered.
Um, I um, I think that one of the most important lessons that we get from COVID, it's that, as I say previously, we have taken for granted our immune system, and we've been really arrogant in the way that we practice medicine, in the sense that I kill the bug, I kill the cancer, and we forget the power that we all hold in our self. And we don't work with it. We work sometimes against it, which I think become a tragedy in COVID, because we realize that an angry immune system can kill us more than a virus.
Well, I believe that the first and most important lesson was that our society was unprepared, and our organizations were totally inadequate to deal with a pandemic. They declared an emergency after 2 months that the first cases happened in China. They happened at the end of November, and only in the middle of January it was really declared a pandemic. So this is really something very important. We were unprepared. We were unprepared, but thanks God, we had the incredible chance to discover practically in 3 or 4 months a vaccine.
So the global economy has spent roughly $10 trillion on the COVID situation, and this is still very fresh in our minds. And while it is, I believe that we should basically stand up a UN agency that does two things. Number one, does global monitoring of pandemic threats, and number two, sets up well, actually three things. Sorry, number one, monitoring. Number two, setting up global laboratories all over the world that will basically make the vaccines that will cure these diseases. And number three, have the ability to inoculate the globe.